signing on. I will just point out some of the features of WebEx that you see on the slide. There's some troubleshooting tips about managing your audio and switching from computer to phone audio. We often find that the phone calling in actually works a little bit better than listening through your computer. The other thing I would say is that through this platform, everybody dials in automatically muted. So we would ask, we had a lot of registrations for this webinar, so we're going to ask that everybody remain muted and submit questions through the chat. To make sure that you can see the chat, you click that chat bubble on the bottom part of the screen, and then you can see them off to the right below the names. If you have questions, we encourage you to, if you have questions during the webinar, to make sure that they go to everyone. And we will be monitoring and looking at those questions. We probably won't have time to get to them all, but we will make sure we answer some and get to as many as we can. All right, without further ado, let's get started. I'm happy to welcome everybody to our webinar on data sharing to end homelessness, challenges and solutions. This is a co-sponsored webinar by CSH, Corporation for Supportive Housing, and APHSA, the American Public Human Services Association. And we are incredibly excited to bring you this information today, which includes two awesome community presenters. So this is who you're going to be hearing from today. We're super excited. So the top one is me. That's not very exciting. That's just me. My name is Kim Keaton. I'm the Director of Data and Analytics at CSH. I do national work in the data and analytics space and support CSH's data integration work across the country. We also have Matthew Lyons. He's the Director of Policy and Research at the American Public Human Services Association. We have Jessie Metcalf from Amazon Web Services, where she serves as the Homelessness Initiative Lead for U.S. state and local government. And then next, we have our two community presenters, Marla Sutherland, who is from Fort Collins, Colorado. She's the Housing First Services Director at Homeward Alliance there. And then secondly, we have Erin Dalton, who serves as Deputy Director, Department of Human Services in Allegheny County, Pennsylvania. Great, and I just wanted to make sure to remind everyone again to please don't unmute yourselves. Please remain in mute. You can find your name there in alphabetical order on the right-hand side, and you're probably at the top. Thank you. So first I'm going to go over our agenda and our objectives, and we're going to just dive right in. So the reason why we came together to do this, to co-sponsor this webinar for this group of people around the country today, is so that we can help communities better learn how about homeless services data, what it is, and how integration with this source of data can help achieve better outcomes in ending homelessness. As we all know, homelessness is something that affects all public systems, not necessarily just the homeless system. We want to help you learn key strategies and learn about use cases from communities that have successfully shared this type of data or are successfully sharing it. And lastly, we really just want to convey how excited we are and generate a sense of excitement about using homeless system data to improve really the cornerstone of stability of people's lives, their access to housing. And one thing we want to remind you, or mention at least, is that we are distributing a brief survey towards the end of this call. We'll put it in the chat box, we'll have it in the slides, and we'll send it in an after webinar reminder. And this isn't just your regular old boring survey, how'd you like the webinar, et cetera. We are wanting to hear from you about your challenges in overcoming data sharing, the systems that you're looking to share with, and the types of technical assistance that would be helpful in your community as we look to develop more resources in this area. So your participation is really, really important. So let's get started. I'm going to turn it over to Matt Lyons from APHSA to get us started.
Great. Hi, everybody. I just want to quickly echo Kim's sentiment. I'm really excited to be here as well and be able to work with the Corporation for Supportive Housing and AWS. This is really important work to us, and finding ways that we can help to support better linkages between human services and housing systems is really something that is absolutely necessary in the work that we do, and we're happy to be able to be a small part of helping to encourage that work across the country. For those of you who may not be as familiar with the American Public Human Services Association, our policy work traditionally revolves around 3 different centers of focus that we call our collaborative centers. We have a center that's focused around child welfare and child care issues called our Center for Child and Family Wellbeing. We have a Center for Employment and Economic Wellbeing that looks at the economic assistance and workforce supports that enable economic mobility. And we have a Center for Integration of Health and Human Services that looks at how you align systems to support family well-being. But as we've done our work and we've been on our journey as an organization to try to move human services to the desired state and get our clients to the outcomes that we want to help them get to, it's really become increasingly clear to us and our members that housing is a fundamental and foundational support that needs to be there in order to get to those outcomes. And with that in mind, we've been looking at ways to engage in partnerships such as this to support a national dialogue to create these linkages. And so if we jump to the next slide, what we've adopted as an organization 6 key levers that we put all of our policy work through to consider whether we are in fact moving the human services system to that desired state that we want to get to. And one thing that, as I reflected on our work and looking at these levers, it really is increasingly clear to me how housing and homelessness is embedded into so much of the work that we do. From modern platforms, within our work, we're always looking at explicit and intentional focus around the use of data and aligning data systems, around creating spaces for innovation. We're constantly looking at ways we can promote innovative practices that really get to the root causes of issues, and so often housing is at that root cause. With integrated policy levers, we're trying to look more holistically and more broadly at how we support families and thinking about housing as an engine to support economic mobility. And then with partnering for impact, knowing that we can go much farther and much deeper with our work when we work across silos to get to that collective impact. So we're really happy to be there. We just want to share that 10,000-foot view with you and really turn it over to the experts that can really talk about how this work is actually happening in the field. So with that, I'm going to actually turn it back over to Kim to talk a little bit more about some of the trends.
Great, thanks, Matt. So for those, because we co-marketed this webinar, I think we have folks from across the human services, homeless services, and other sectors. So just a little bit about who CSH is, stands for Corporation for Supportive Housing. Our mission is to advance solutions that use housing as a platform for services that improve the lives of the most vulnerable people, maximize public resources, and build healthy communities. We really feel that better data is key to advancing all 3 components of our mission. And so I'm going to start by setting some groundwork around what homeless services data is and what's in it. For those partners on our webinar who may not be totally intimately familiar with these, those that you are, I ask that you bear with us for this one short slide. So it's referred to often as HMIS. Some communities call it HMIS or HMIS. Stands for Homeless Management Information Systems. Each continuum of care that is funded by HUD, this is a collection of providers in a region that are comprised of homeless service providers throughout a region, whether that's at the county, city, multi-county, or state level. Each continuum of care is mandated to maintain a homeless management information system and designate a lead over that system. The types of data is input by providers, partners across the region. Their data sharing is governed by policies and procedures that are usually available on the COC's website. They collect the kinds of things you see here. Some of it's pretty standard. around, demographics, et cetera. The services data is the type of entry and exit dates for various types of interventions that are funded through the Continuum of Care program. So that's emergency shelter, transitional housing, rapid rehousing, permanent supportive housing. There could be outreach data in there and other data on other types of services like drop-in centers. There are exit dates and exit reasons and destinations. So if known where people are going after they exit a permanent housing placement, are they returning to jail or homelessness? Have they been hospitalized at a level facility with higher care? There's all sorts of information available through HMISs, and it's been really growing and improving with quality over time. The second thing I want to talk about is just the motivation that continuums of care have for sharing data. I've been in this field about 8 years, and I've seen, actually more 15 now, and I've seen just a flurry of activity around data sharing and interest in data sharing from with HMIS over time. And some of the motivation comes with some guidance for COCs that was issued by HUD about almost 3 years ago in early 2017, where they encouraged that utilization, or they stated that utilization of crisis or emergency services, such as emergency rooms, jails, and psychiatric facilities, for example, could be used as a prioritization factor for housing placement. And so this is important for continuums of care because they have coordinated entry sort of processes in place where people are coming in, being assessed through a common instrument, and then prioritized based on a range of factors. And COCs are allowed to use high utilization of crisis service use for that prioritization. And of course, the only way to get that information is through data matching. So we view this as an opportunity really across human services, not just for homeless data. And so data is really the secret sauce that can bring partners together. This goes from early on in life, so for clients or families that may have involvement with the child welfare system. Education is not on this diagram, but that's another one, to the healthcare system, hospitals, managed care, emergency transport providers, and then the justice system, so jails, police, courts, and in addition to behavioral health. There are even more systems that are on here, and there's just all types of use cases and opportunities for care coordination and improving lives with shared data. And so, like I said, there's been a flurry of activity happening, and these range from the communities that are just really trying this for the first time on what I call the lower tech side of thing, where they're just doing one-time matches. They're really figuring out across systems how, for example, jail data and homeless data overlap, and what does that intersecting population look like. It's a great way to get to know each other and help determine, for example, a target population for a small pilot program. And then there are a lot of medium tech solutions being developed out there. So, repeated data matching or system integration where there's a way or bridge or API or data integration tool. Actually, you're going to be hearing about that from Marla in Fort Collins, where data can permanently flow from one system to another, or at least on demand, and people can potentially be identified on a rolling basis as they grow into eligibility. Provides an opportunity to use data for other use cases, care coordination, and hopefully further that systems change we're all looking for. And finally, there's the high-tech solutions, which you're going to be hearing about from Erin in Allegheny County, that are, data warehouses or real-time multi-system data exchanges. They can be, they can cover a county area, or they can be at the state level. You're really likely to see people across many systems this way. Of course, it's more costly. Of course, it's more time-consuming, both from a resource standpoint and from a work standpoint, and requires significant leadership, but this is really where we feel the field is going. And so that is the end of my overview. I'm now going to cede the floor to Marla Sutherland from Homeward Alliance in Fort Collins to talk about opening doors through data.
Thank you. My name is Marla Sutherland, as mentioned, and I work in Fort Collins, Colorado with Homeward Alliance. So I'm going to focus on how Homeward Alliance became one of the leaders in our community surrounding data. So Housing First Initiative was a 2-year pilot program that started in June 2017, and it was a partnership between Homeward 2020, which is a collaborative strategic think tank guiding implementation of Fort Collins' 10-year plan to make homelessness rare, short-lived, and non-reoccurring, and Homeward Alliance, which operates a continuum of programs and initiatives ranging from critical survival gear to employment services to homelessness prevention. Since its start in 2017, Housing First Initiative's program measurables and outcomes have earned its right as a permanent program in our community, and it is currently operated and managed by Homeward Alliance. So some of the outcomes Housing First Initiative reached and the reasons that Housing First Initiative was brought to our community was we wanted to create actionable data. Our point-in-time count every year was around the same amount of people, around 350 folks experiencing homelessness in that given night in January, but it didn't dive deep into that data. It didn't tell us, is it the same folks every year? What services were these individuals and families accessing? What services weren't accessible to these individuals and families? And we wanted to understand our community's strengths and gaps better. Collaboration is our community's strength, and partnership and collaboration. The Murphy Center is an excellent example. So the Murphy Center is a collaboration between 20 independent agencies and countless community partners in one location. It offers more than 40 services to nearly 3,000 people each year. While the Murphy Center is a collaborative of 4 local agencies, Homeward Alliance is the managing entity of the Murphy Center, and that is where Housing First Initiative program is located. So when HFI first started, Murphy Center was sitting on a gold mine of data, but it didn't have the infrastructure, the database, or the procedures in place to support it. All intakes that were collected were stored in cabinets and not entered into a database because we didn't have that comprehensive database to offer. And so another piece of this is data collaboration and then also piloting Housing First services in our community. So offering solution-based services and staff capacity to our coordinated assessment and housing placement system, which stands for CAPS. And so CAPS dialogue and case conferencing shifted from this person doesn't meet our program's eligibility requirements to HFI saying, yes, we can offer case management support to the next person on the list. Since Housing First Initiative offered permanent supportive services, our team reached service capacity fast due to ongoing need for housing retention case management, not just housing navigation. So I wanted to share and highlight our interactive data dashboard that is updated quarterly. And so we have a population dashboard as well as a system level dashboard. On the slide there is the websites to get to those, and it is a resource that impacts many different audiences. The dashboards educate our local community, inform political leaders and legislation, and also offers real-time snapshots to key stakeholders and funders. And it is interactive. So let's say you're talking to another service provider who focuses on seniors. You can press the age distribution pie graph with seniors, and then the whole web page will change and give you the data field specific to that age group. So we were part of DASH, which is data across systems and CSH was our mentor, and they offered us access to their data matching tool, which is an amazing tool. The setup and installation of the data matching tool is meant for technical experts, however, which I am not. That is not my background. So we don't yet have staff roles dedicated to data analysis and implementation, so we are at a little bit of a standstill. We are right in the middle at common schemas, and so we've been able to collect data lists from the criminal justice systems, the healthcare systems, and then homeless service provision systems, validate that data, and have the infrastructure set up in order to utilize the real-time and historical functionality of that data. But right now we're working on creating common schemas on how to merge those. So luckily, our facilities manager has an extensive background in technology and was able to understand the setup instructions language and spent over 40 hours of time getting the system set up, even though that wasn't part of his job position. We're a smaller nonprofit. We have about 26 employees, and so we are able to adapt and innovate and kind of move our positions around a little bit to meet certain needs. But we aren't able to accelerate that process quite yet until we have a position dedicated to data and someone who is an expert in the field on coding and creating schemas. Since Fuse's resources were awarded before the schemas were complete, we needed to start matching data sets immediately. So we created an Excel document that recorded the data list from partners into one format. And our partners include City of Fort Collins Police, Larimer County Jail, Cooter Fire Authority, UC Health, Murphy Center, Housing First Initiative, and Outreach Fort Collins. So how we were able to implement Fuse in Fort Collins, Colorado, we had a lot of funding and capacity resources. Department of Housing, we are very lucky to have Colorado Department of Housing as a support in our state. We received 20 tenant-based housing vouchers for this demonstration project, as well as funding for full-time employment for clinical case manager dedicated to these 20 individuals receiving Fuse services. We also contracted with Colorado State University to provide 1-year data analysis and reporting on the first year of Fuse so that we can have everything we need to scale up next year. Our project managers are Holly, who is the Executive Director of Homer 2020, and Jess, who is the manager of our health district's Behavioral Health Strategy and Implementation Community Impact Team. And then Homeward Alliance is responsible for the supervision of the clinical case manager in the Department of Housing reporting. So 3 things that were able to push us forward in Fuse was creating business partner agreements, which created new routes of communication and accountability between our systems of criminal justice, healthcare, and homeless service provisions. It outlined defined responsibilities for wraparound services specific to Fuse. The universal release of information upholds clients' privacy rights and HMIS standards. But we also learned that we had to be okay with outliers and being open to make compromises, such as our local hospital emergency room wanted their release of information to be signed in addition to the universal ROI. And so we added the ROI, and we're still working with our legal team to figure out how we can create a more universal one moving forward. But we still wanted to move forward with the implementation of Fuse. And then data use agreements serve 2 purposes. Number 1 is setting the foundation for integrated data, and number 2, incentivizing buy-in from partners through community level reporting. So we've come a long way since Housing First Initiative first started. HFI is one of the leading reasons that Fuse came into our community because we have the data to prove the need for Fuse. However, we still face some challenges before we reach our vision of integrated data. I've already mentioned the challenges we face, so I will focus on where we are headed. Northern Colorado is in a transition phase, working towards becoming our own continuum of care. Homeward Alliance will be the HMIS lead agency in our region when that happens, which would give us access to federal funding ability and the ability to create a position role dedicated to data and technical support, which creates resolution for each of the challenges we currently face. So I'm going to turn it over to Erin Dalton, who is the Deputy Director of Allegheny County Department of Human Services.
Great. Thank you so much. I appreciate that example. It was very interesting. Thanks for having me on the webinar. I'm Erin Dalton. I'm a Deputy Director here at the Department of Human Services in Allegheny County. I'm not a homeless expert. You guys might know some of my colleagues, Abby Horn, who runs homeless services, or Andy Hassel, who works on the analytics for us here. I'm glad to have the opportunity to share what we've done. The Department of Human Services is an integrated human services department, so we provide services all the way sort of from birth through aging services, early intervention, child protection, behavioral health, and lots of stuff in between. So that's a little bit about the agency. So I will now show you an embarrassing amount of integrated data. We've been at this for a really long time, so over 20 years, and I'll get to some enablers and detractors at the end of the presentation. I won't read through this for you, but we have robust childhood and even education data. So Allegheny County is actually a pretty fractured place, 42 school districts here, but we've got data from Pittsburgh Public Schools and a number of other districts, child welfare, family court, obviously the homeless, HMIS information. We have housing authority data, employment, unemployment, all of the physical health and behavioral health, Medicaid and uninsured, juvenile and criminal justice, and vital records. So we're very fortunate to have these kinds of data coming in regularly, from every 15 minutes, sort of more real time to weekly loads. So we use these data to support a lot of different functions. I'm going to focus on kind of the first three, sort of coordinating care, which is really important to us, and really the reason why this data warehouse was built, and worker and management decision making. So first on coordinated care, I'm just going to show you a couple of screenshots, just two, I think, from our application that we call Client View. Client View is a person-level view of the data warehouse, and it allows our workers and our providers and clients themselves to access their integrated records. So just a couple of highlights. So there's a demographic and service info tab. There's electronic documents, service plans and assessments, and a tab for clients' workers, so you can connect with people already working with the client. I'll highlight a couple of things here that maybe give you a little insight to how the data warehouse works. So you can see, for example, like an MCI ID. We store other client IDs as well. We allow one record to win, so we have 11 other records, for example, for this person's address. So we might have an address from the HMIS system, so you could click on that and see that information. And there's a little tab there or a button for the 911 data. So 911 data is associated with the address, not the person, but that data is viewable there as well. On the next slide, you'll see, again, this is not the detailed view of Client View, but it gives you a timeline view, so you can see the kinds of information that we have in the system. You can imagine being a housing provider, whether it be a family shelter or permanent supportive housing provider. You've got a new family or client you're serving. You want to integrate care. You want to make sure there's appropriate mental health service connections and so on. You could use the Client View system, or you could help the client themselves use the system to access their service history and connect with other with providers they may be working with and have worked with in the past and want to reconnect to. You can also see those blue dots at the top are life events. Those happen to be births of children. All right, moving along to worker decision making. So this isn't the only way we support workers, but all of you know the HUD mandated, and I think we were very excited to move towards a coordinated entry system. You all get lots of calls. We do 2 for homeless services. We were using, and we still are today, using the VI SPDAT assessment tool And the question is if we used the data we already have, could we make different, better homeless decisions? So my view of the world is it's sort of a progression in improving decision-making from gut, essentially. So this is the way decisions probably were made prior to coordinated entry and VI SPDAT. Who should we prioritize for these services? HUD makes rules about this. Chronically homeless veterans, families, and so on. So that's an attempt to prioritize higher risk, higher need population by putting in place rules-based approaches. The VI SPDAT and other tools like that are kind of the actuarial tools, so question and answer, research-based, and then predictive risk modeling, which uses the data that we currently have, predicts the likelihood of an outcome, and provides that back to the worker to help them make a decision. So we've been moving towards predictive risk modeling in our work for a while, and are in the final stages of working through the implementation to support homeless decision making. So we use a lot. I'll skip over the fine points here, but we use a lot of data in these predictor models. So 322 predictors for each individual, lots of household level characteristics as well. Importantly, I think you'd be interested in what we're predicting, right? So in this case, we're predicting the harm of homelessness, essentially, if left unhoused, right? So simultaneously predicting the likelihood of a booking in the county jail, a substance use treatment service, inpatient mental health stay, or actually 4 or more emergency department encounters. So simultaneously predicting those 4 outcomes within 1 year of that index call. Using a bunch of different modeling methods, we work with a group that we competitively procured a partner out of New Zealand, so Rima Vaithanayathan and her team at the Auckland University of Technology. So they built us a model. Here are some results of that model, comparing the VI SPDAT to the predictive risk model. If we think about a score from 1 to 10 in the predictive risk model side, what you see there is for people in the top 10% of risk, those 10s, they have far higher likelihood of things like a mental health inpatient stay, a jail booking, a substance use service, and so on. Where when you look over at the on the left to the VI SPDAT, it's relatively flat in their scoring. And so what this tells us is that the predictive risk model can help pull out those higher risk clients who we might want to be prioritizing services for. So just kind of an example of that, when we looked at how we were scoring folks, so if we produced a predictive risk model score for people that we have provided permanent supportive housing to in the past, clearly this is a group that we would want to be serving the highest risk, highest need, and about 1/3 of our permanent supportive housing beds were being provided to folks who have relatively low risk of those kind of harms if unhoused. If I go backwards, you can see those 1 through 4s of like close to no likelihood of those events, a booking in the jail, mental health inpatient, and so on. We know and can see here too that things like permanent supportive housing work better for higher risk clients. That's not to say that people that are relatively low risk don't benefit from these services. It's just that they have a relatively low base risk of things like 4 or more ER visits or a jail stay or mental health inpatient. So we see for high risk folks, permanent supportive housing really reducing the risks of those events when they're provided with it, and essentially flat to very small kind of increase in those harms. I wouldn't interpret this as permanent supportive housing increasing harms for folks. I don't think that's the message here. It's just that it works better for relatively high risk folks. So just to mention a couple of enablers and detractor, I think I have 1 minute left, so I'll do that quickly. I think it's really impressive what Fort Collins folks have done, particularly led by a nonprofit. I think it's helpful that we are approaching this from the government side where we've got other government partners. It's an easier negotiation. We've integrated Human Services Department, which is a huge enabler in that we start with the human services data we have and built other partnerships. Not replicable. We've had human services, same leader here for over 20 years who's made big investments in technology, analytics, and innovation. Lots of community support to do this integrated work and take risks to see if things like predictive risk modeling can improve decision making. And then on the detractor side, just want to mention we have a custom HMIS solution, and we tried over the past year to move to one of the marketplace solutions, a COT solution, and I just find that we're essentially walking away from that after a lot of work to try to make it happen. I just find that the current HMIS vendors are not capable of doing integrations very well. They're just not built for that. And that really hurts the ability, obviously, to integrate data, do innovative things like build in a predictive risk model to a coordinated entry system. So I'm hopeful that that market will mature because that's certainly the direction we wanted to go and had to pull back. I'll just say one more thing in my last moments. You can go on AlleghenyCountyAnalytics.us. There's just like a thick amount of dashboards and reports, including client voice reports about our homeless system. And under tools there, you can find the quickcount tool that allows the public to do crosstabs. I had some slides that I had no intention of presenting, but wanted to have in the presentation for you about frequent utilizers and just complementing the project in Colorado, looking at other service usage. So thanks very much, and I'm happy to take questions.
Hi, can folks hear me?
Yep. Yes.
Great. So this is Gabe Schuster from CSH. I wanted to take a quick break before we jump into the facilitated conversation to circle back to some of the questions that were being posed in the chat. And these are really fantastic, so thank you everybody for chipping in. The first one, and this came as no surprise to me, was posed during Marla from Fort Collins' presentation, and this was about the ability to share some of the privacy documentation like data use agreements or releases of information. I'm actually going to open this up a little bit more broadly to folks because this is an incredibly common question that we tend to see in these conversations where folks really love to have examples or templates that they can draw on. So if any of the other presenters also have examples of repositories or places where they've pulled from that information, I'd love to have other folks chime in on that as well if possible.
Marla, if you're talking, we can't hear you.
Oops, thank you.
Now we can.
Thank you. I'm happy to share those documents, and CSH is a big reason that those documents exist. They offered a lot of support and different examples from other communities in data use agreements and business partner agreements. And so I would also recommend folks get tied into CSH services if they haven't yet already. But I'm happy to share. Gabe, I don't know what the best way to share this is, but I can meet with you offline and figure that out.
Yeah. This is Kim, and just to note to everybody, there's a couple questions about this. We will be sending a link to the recording along with a PDF of the slides and a link to our survey after this, and we can include, Marla, any resources that you're able to provide. Great.
Awesome.
Maybe one more question?
Yeah, another question coming from Donna. She asked that, situated within a COC that is a balance of state and being in a rural community. She was curious, how does a potential developer of homeless housing integrate data when, as a developer, they don't have experience with HMIS? They are participants in the COC, but are a housing developer that doesn't have experience with HMIS.
That's a good question. Erin, do you have any thoughts about that?
Yeah, could you mind actually could you repeat the question?
Yep.
Or just paraphrase for me.
As a potential developer of homeless housing, but not someone with experience or an organization with experience in HMIS, what might be some useful strategies for integrating data?
Yeah, I mean, there's so much to that. I mean, I think clearly there's a huge issue in terms of the partnership side and the agreement side, and I find that most of that is really the challenge, is getting through the kind of partnership legal issues. I do think that there are matching off-the-shelf matching algorithms that are working really well for folks these days. And that the actual technical integration of data has gotten more simple over time.
I agree. Maybe this actually just one final question for you, Erin. Somebody asked a specific question about the predictive risk modeling, asking how you apply it, as in, are those 4 questions a yes, no, and they rank? How is it captured and then quantified and applied?
Okay, yeah. Thanks for the question. Yeah, this gives me an opportunity to clarify. So the way this will work is we have all of the history for everyone we've ever served, essentially, and the vast majority of people coming into homeless services will already have an existing ID within our system, so 97% or so, that's what we think. So what will happen is people engage for services, and as part of that process, when we have enough identifiers to check our system and create match to an existing master client ID, the score will simply run in the background. So it's taking all of this client history for everybody associated with the call, if it's a family, for example, and saying what's the likelihood of these 4 outcomes. So it's certainly not a yes, no. There's no questions to be asked, and that it'll essentially rank that person relative to all of the others in our historical data set. And so it provides that score within a minute without asking those kinds of questions. Now, it doesn't mean that our workforce doesn't want to engage with the client and might have questions that would help better serve them, but none of those things are necessary in order to provide the score.
Great. Thanks for that clarification. It's really interesting. So we're going to move into about a 15-minute panel discussion right now. I wanted to start with Jesse Metcalf from Amazon Web Services, who's on this call and who has been engaging across the country in this work. I want to know what Amazon's been doing with communities and what are you seeing them grapple with when it comes to homeless data? As I understand it, you've been encountering this problem all over.
Yes, thank you. So excited to be here on the call. I'm part of the state and local government team at Amazon Web Services, and we work with government leaders across the country using cloud technology to transform the way they deliver citizen services. So that means when we're out there talking to a mayor or a governor, police department, or leaders across human services, and we're asking them about what's keeping them up at night, so many of them are raising concerns about homelessness in their community. And they're looking for innovations that they can use to support their efforts to prevent and combat homelessness. And we all know this on the call, homelessness impacts urban communities, suburban communities, rural communities, and citizens are holding their leaders accountable for those solutions. And although every community is unique, there are there are definitely some themes that I see in my conversations across the country, and we've touched on them all today. It's about disparate data. The data and the systems that impact client care are disparate and siloed, spread across, multiple entities in a community, but even across departments within the same agency. So at a local level, I'll hear things like, I would like to be able to share HMIS with county health and human services data, behavioral health data, even probation data and eviction data, because there's an absolute appreciation for how much the data could help with preventative efforts rather than just sort of triaging once a person is experiencing homelessness. But at a state level, a lot of the conversations have to do with connecting the different HMIS data sets together. They're doing this across many states. Most recently on my mind is the state of Massachusetts. They're building a data warehouse to connect 18 different HMIS data sets into one view, because today states without a view like that really don't understand the scope and the individual communities that are impacted by homelessness, and they have to wait for the point in time count on an annual basis, and that's not enough. And I mentioned citizens are holding leaders accountable for doing more. And while technology can pull these disparate data sets together, and that's definitely the work that we've been doing at AWS, the heavier lift is this second item, what we've been talking about today, around data sharing, capacity building. The homeless crisis response within a community really depends on sharing data, but navigating all that sharing and the privacy concerns, it can really be paralyzing. And that's why I knew that I needed to partner with data sharing pioneers like you, Corporation for Supportive Housing, and with APHSA to inspire the health and human service leaders with examples. That way they can start a movement in their community. And then the third and the last theme that I hear is this challenge around storing vital records. People experiencing homelessness don't have a safe place to store the vital records that are so critical to tapping into the services that are available to them. Birth certificates, social security cards, proof of disability, those all get lost behind, stolen, and they can only be replaced so many times, it really becomes an inhibitor. And people stay on the streets much longer than they need to. And I've been very inspired by the work in my own community in Austin, Texas, where the innovation team is designing a solution to digitally manage all of those vital records. And I'm using that inspiration to work with other customers across the country on similar efforts. Kim, I just really want to thank you again for including me in today's call. This work is near and dear to my heart, and APHSA and the team. You're doing a great job today, and Erin. And Marla, thank you for sharing your best practices in your community.
Thanks, Jessie, and it's really great to hear the perspective from someone sort of outside of our world of homeless and human services who is coming to us and saying, hey, you guys need to do this a little bit better. We appreciate that. And so I have a question for Marla. I think that might have been fairly obvious from the choices of our presenters today that, in Fort Collins, you guys are building the plane, and in Allegheny County, you guys are basically flying it, right? So there's like someone, since you're kind of at the beginning of the process and you're putting things together and developing schema, Marla, once the data's together, what do you think you'll be able to do that you could not do before?
That's a great question. So I think we can focus more on intentional action. I appreciate CSH's HMIS data matching and exchange types graphic that was shared earlier in the presentation. It validates data integration as a tiered approach, thus validating each step along the way, which is encouraging as a smaller nonprofit agency working towards data integration. So Fort Collins' goal is to achieve real-time multi-system data exchange. Currently, we are still working within the system integration tier. CSH's data matching tool allows for real-time data to be shared across sectors. It also saves all historical matched data sets to better understand community trends and gaps over a period of time, which offers measurable benchmarks. We will be able to offer specific recommendations to stakeholders, as well as being able to quantify and monetize our funding requests. With Fuse specifically, we are working with Colorado State University on data analysis over the first year of program implementation so that our scale-up project next year is equipped with the quality data to further prove our needs.
Great, thank you. And I'm gonna, it's 10 minutes, so I'm gonna kind of skip around a little bit with our questions, but particularly Erin, I wanna know if you have a story to tell about how service delivery has changed or improved as a result of the homeless data integration with other systems there in Allegheny County, and if you wanna use the predictive risk modeling as an example or something else, and where I think we're all eager to hear about any stories that you have.
Yeah, thanks. It's a good question for sure. Maybe I'll start with a maybe surprising finding, which might not be that much of a surprise, but in our work with the school district, under different federal definitions, homelessness is defined differently. And so one of the things we were able to do is take the kids that the school district consider homeless and match that with our who we consider to be homeless under the HUD definition, versus McKinney-Vento, and just found amazingly, the lists were about the same number on each side, but with very little overlap. And so this helped us kind of partner differently with the schools to think about, a broader idea of homelessness and opportunity for, sort of true, if you will, under a HUD definition, homelessness, so keeping kids and families from becoming homeless. We certainly use, so you can imagine also HMIS data being useful to other systems, right? So having in client view previous homelessness can help our mental health system providers, our child welfare workers see those potential risks, engage families and people on them, and help to prevent homelessness going forward. So just asking about housing stability. I'm pretty excited about putting some models upstream designed to prevent homelessness, right? So I presented a tool, a predictive risk model that we can use to help improve decision making once people are asking for homeless services. But when we look at the integrated data, there are a couple of really good places. So mental health crisis services, particularly frequent utilizers of mental health crisis services, their rate of future homelessness in the year after is really, really high. And so if we put in a model there, we could engage people in housing support services prior to the need for homelessness. So there's a couple of other examples like that where you could move tools by using the integrative data at a descriptive level, move those models upstream to help prioritize, again, the many, many people that have need for mental health crisis services earlier for housing prevention, homeless prevention rather.
That's great, Erin, and I was going to ask you later what the future holds for integrated human services data, and I really think you actually just described it, particularly with respect to preventing homelessness from ever occurring. So I'd like to also ask you both, so, maybe starting with you, Marla, what was harder than expected in getting to sort of yes around sharing homeless data, and what was easier than expected?
Oh, that's a good question. I think the build out and setup of, creating data collection procedures and then figuring out reporting tools was really time consuming, but well worth the time. In the beginning, data collection was me manually entering all information, which was an 8-page intake at the Murphy Center, into an Excel sheet. And there were over 600 unduplicated individuals that I manually entered. And so that wasn't very sustainable, and it wasn't an efficient process. And so luckily, United Way offered innovations grant for us to be able to fund a more efficient and effective database system, which is our Clarity's Fit Focus. which was a strategic choice on our end because a few months later, it was chosen to be the statewide HMIS platform. And it allows for customizable data fields and reporting functionalities. We can dive deeper into the data than we had ever expected. We're still working towards standardizing the data and as I said earlier, creating schemas between the data fields, but it's amazing. My tears of exhaustion turned into tears of joy. The reporting possibilities are breathtaking. The customization is perfect for a region, and the standardized updates the system offers so that we can meet the statewide HMIS guidelines is seamless. And so the hardest part of this project ended up being the easiest part in the end.
That's fascinating. And I guess, Erin, from your perspective, with an integrated human services data system, what is harder than expected and what is maybe easier than you would think?
Yeah, I mean, the maintenance of these systems is real and is expensive. So people change data systems all the time. They don't tell their data partners. It requires changes on our side, like really, really strong quality assurance to make sure that all of your work done to integrate doesn't like turn to zero because it's not right. So we've gotten better at that over time. It's an ongoing struggle. And it's hard and like expensive, time consuming at least. One thing I think is like just worth saying is like I just think it's worth keeping up, like keeping at it. Like we'll like, you know, I don't know, we tried to negotiate an agreement with Pittsburgh Public Schools for like 6 years, and then they just like finally said yes. The same is true. It's always 6 years too, at least in my mind it is. With the state workforce on the Department of Labor and Industry for the workforce employment unemployment data, they said no forever, and then like nothing changed in the law or anything, but they just decided to say yes. And if I am willing to be helpful for the nonprofits there, that government should be willing to share data with nonprofits in order to help support care. So if we can be helpful in making that argument, we certainly live that. We're sharing client view, for example, with our nonprofit providers.
That's great. So that was I'm going to wrap up the questions right now. Gabe, do we have any, I just see a lot of activity in the chat. It seems like people are helping each other, which I think is really cool. Gabe, are there any specific questions for our panel that you think we can answer in our remaining couple minutes?
Yeah, definitely want to reiterate that the conversation going on there is fantastic. It's really cool seeing people sort of support one another in the chat box. A few questions that did come up that I think might be interesting to hear comments on from our panels. One being that it would be great to hear about how or if racial equity is being measured or improved through the collection of data. So if that is a factor that's being considered, or if the data is being collected in the first place through the integrated data work, and how that might be used in administering services or creating policy.
Yeah, this is Erin. I'll jump in there. One thing to just note is that Broward County, Florida, has been doing really good, interesting work on thinking about racial disparities and racial equity in sort of integrating data. And so I think there's somebody to look at there. I will say that, and that's something we're learning from and glad to have folks to learn from there. And there's lots to say. I'll jump in kind of on the predictive risk model there, because I think that's where also people get concerned, is if we use data that has, you know, sort of bias going in, that it would create biased outcomes. So in the end, when we go live with this model in homeless services, we'll release full methodology paper, specific look at fairness and discrimination in the modeling, an ethical review, our response to the ethical review, and so on. And we do look at this by various racial subgroups. the one thing to say here is, like, it does really need to be tied to the intervention, and it needs to be compared to what was being done in the past. So are decisions better or less biased or so on compared to the way decisions were made in the past, as opposed to being compared to some ideal, which we all strive for but isn't, you know, nobody's there yet. The sort of, if you will, nice thing in homeless services is if the data, you know, if the data is biased and that more people of color are being sort of captured in these systems, the likely outcome there in this case would be more access to housing, right? And so, so it's different than, for example, our work in child protective services, where the likely outcome would be potentially a child welfare investigation. I will say, because I just want to highlight the we will evaluate all of this work, and in our evaluation on the child welfare side, the Stanford University impact evaluation found racial disparities closed. I mean, not closed entirely, but were reduced using a predictive risk model in child welfare, and so I think. First, it allows us to really look at these things for the first time when you're using data to make decisions, as opposed to just something rules-based or gut, because you can look at the results for various subgroups.
Thank you. I think that was a great way to wrap up this webinar. I want to, we are a little bit after time. I want to be respectful of people's time and extend a thank you to Matt, Jesse, Marla, and Erin for presenting today. Gabe, can you put that survey link in the chat box? I wanted to, let's see, we have a survey link going in the chat box, so if you could just hit that and go ahead and fill that out. Again, it's not just a boring survey. It actually asks you what you need and what you might be looking for in this area. So I really encourage you to fill that out. On this slide, you see the contact information for everybody who presented on this call. I wanted to say, again, thank you for everyone who attended this webinar, for making the time out of your busy days to learn about this topic. We were actually blown away by the response to the webinar. We had almost 800 registrants. So once again, thank you. Put that link in the chat box so you don't have to scroll up one more time, and kind of leave it open for a sec as everybody starts logging off. But thank you, and have a great rest of your day.